Hi, uh, good afternoon. My name is Dr. Ananya Putraju. I'm a senior consultant orthopedic surgeon at HOSMAT Group of Hospitals. I would like to first thank for this opportunity to share my thoughts and experiences regarding hip uh, joint and hip replacement surgery. Uh, a bit about myself. I did my medical degree from Davangere, following which I was in Great Britain for about 15 years, where I completed my post graduation, did my master's MRCS, and then what's called a fellowship from the Royal College of Surgeons of Edinburgh. Since I've come back from 2016, I've been working initially at Spurs and now at Hosmat Hospital. So, coming to the hip joint is one of the most basic foundation joints in our body, which helps for our locomotion, for us to walk, and also helps us in our gait, for us to stand straight. So everything is this is the basic backbone, I can say. It's a ball and socket joint. It is the joint which connects our pelvis to our legs. So we have what is called as a ball, and that there's a socket. So the ball rotates in the socket. So that's called as a ball and socket joint. So we have a right and a left hip joint, and this is the joint which helps us in our stride, or when we walk, when we run, when we jump. This has 360-degree rotations. You can bend the hip. When you bend the leg, you can what we call as abduct, get it sideways, cross leg it, and even push it backwards. So it has got a very great range of movements. Now, the hip joint, as I said, is a versatile joint with lot of joint motion. One of the commonest things that can affect a hip is, let's start with something very benign and simple, what is called as a trochanteric bursitis. What is trochanteric bursitis? It's an inflammation of the muscles around the hip joint. So we have this hip joint which has got this muscle around it which is inflamed, and they typically complain of pain on the side of the hip. They find it difficult to sleep on that side. Sometimes it can be swollen. um, so this can be easily treated. What it needs is what we call as an abductor exercises. We do physiotherapy to strengthen that in terms of ultrasound and IFT treatment, and a simple painkillers will do the trick. And avoiding to sleep on that side, okay, so that no more pressure goes on there. The next common thing that affects the hip is called as a referred pain. What do I mean by this? A back pain, which is your lower back, can sometimes radiate down, and this can present actually as a hip pain. So patients keep complaining that I have a pain in this thigh and outer area with the numbness going down the leg. This is actually a back pain, and it's a back pain which gets referred down the leg. That's a second. Now, the other things that commonly affects the hip joint is hip arthritis. What is hip joint arthritis? Arthritis means wear and tear of the joint. So this ball and socket joint, as I told you, this has got a covering like the threads of your tire, which basically makes it friction free so that it can rotate freely. When this bush gets worn out, the bone inside gets exposed, then they start rubbing against each other. That is called as arthritis. So, why do people get arthritis? There are so many reasons why we get it. The commonest one is called as a primary arthritis or a degeneration, where the cause is not known. It's usually common in elderly age group, more than 60 years of age. But luckily, compared to the Western world, Indians do not get this primary arthritis of the hip that common as compared to a knee arthritis. Knee arthritis is very common in India. But come to the hip, for some reason, Asians, especially Indians, do not get the primary arthritis in the knee, in the hip. Sorry. What we commonly get is a secondary effect. So, for example, you must have all been known about COVID, and one of the treatment that changed COVID management and helped save a lot of lives was the use of steroids. So, extensive use of steroids, especially when the lungs was congested, inflamed, and the saturation dropped, then the steroids were given in order to reduce the inflammation in the lungs so as to save the lungs, so the life. But one of the side effects of this is the steroids, when taken in large quantities, can obstruct or block the blood flow to the hip joint. So this ball and socket joint has got these blood supplies which come and supply this, like the roots of a plant. So what this steroid does, when taken in larger quantity in a short period of time, it blocks these blood vessels. The small blood vessels get blocked, so there is no longer blood flowing to this area. When the blood stops suddenly flowing, as you can understand in a heart attack, when the blood flow through one of the arteries is blocked, similarly, when some of these arteries to the hip is blocked, they don't receive blood supply. When they don't receive, it is called as avascular necrosis. What is it called as? Osteonecrosis. Means osteo means bone, necrosis means death. So because of lack of blood supply, some of this bone, the hip joint, will die. So it's not receiving enough, so it is dead. So when we put weight on such a joint, what will happen, instead of normal physiological wear and tear that takes place, will not be able to, because there is no blood supply. So that area, instead of being a ball, will become flat, because that is being punctured, if I could use the word. So that is no longer moving smoothly inside the hip joint, and then they start getting stuck. And that is a hip arthritis that happens. So, avascular necrosis of the hip has become very common post COVID, mainly because of the use of steroids. I mean, we used to see very infrequently, which was alcohol related, or maybe due to certain medicines that have been taken for a long time. But now, the single most commonest cause of avascular necrosis of the hip in India is now become post steroid use post COVID treatment. So when you get, unfortunately, one of this, there are different stages to it. So depending on how long and how much of the blood supply was blocked by the steroid, either some part of the hip can get damaged, or a significant part of the hip can get damaged. We grade this from grade 1 to 4, depending on how much of the hip is actually involved and damaged. So it so happens that as more and more of this hip joint gets affected, the patient gets more and more pain. Movement of the hip becomes painful. It gets actually stuck, uh, and they present to us with pain. If the person comes to us in an early stage, let's say stage 1, where what we call as a collapse has not actually taken place, it's called as a pre-collapse. So the blood supply has been blocked, but the shape of the hip is still maintained. If he comes in this stage, then we can try to re-establish the blood supply. How do we do that? We basically make what's called as a core decompression. We make some holes in the hip, in the bone, so that a new tunnel is created for fresh blood to go in. When the fresh blood goes in, it takes in the healing materials, so that that part of the hip which was damaged can be revascularized and a healthy tissue can form. So this is called as a core decompression, and this works well in the early stage. But when person presents at a later stage, stage 3, when the collapse of the bone has already taken place, then this surgery will not be that beneficial. Then we go for a total hip replacement, where we basically take away the diseased head and we put an artificial joint inside, so that there is a new ball and socket joint, so there is no pain and the patient can walk. So I'll talk about hip replacement implants at the end. Few other conditions that affects the hip joint. One is called osteoporosis. What do you mean by osteoporosis? Osteo means bone, porosis means weakness. So, weakness in the bone is osteoporosis. So, this weakness can happen to any part of the body, but spine and our hips are commonly affected. So what happens? This is especially common in women post-menopausal after 15 years when the estrogen in the body reduces because of menopause. Normal estrogen helps in locking calcium in the bone. It is like a doorkeeper of calcium and keeps the bone healthy. When this suddenly drops after menopause, then there's a rapid loss of calcium from the bones. And this leads to what is called as osteopenia, that's weakness, and finally to porosis, that is holes in the bone. So what happens, even a small jerk or a small slip can result in fractures or breaking of the hip. You might have heard of any of your senior family members or your relatives who would have had a hip breakdown or a fracture which had to be fixed. So that is the other condition. So far in the hip, we talked about avascular necrosis. Then we have touched upon osteoporosis. So this osteoporosis, even a trivial fall will cause the hip to break, and that needs to be fixed or replaced by a hip replacement. So this is a very significant event in the patient's life, and so it's very important to maintain a good quality of your bones. How do you keep your hip bones, or for that matter, any bone healthy? Three important things. First is exercise. At 20 to 25 minutes of physical exercise minimum a day, where your heart rate is about 20% of normal. So if your normal heart rate is 80 to 85, if you can keep it around 9500 for at least 20 to 25 minutes, that amount of physical exertion is very good and very important. That's the basic. The second thing is the good diet. A diet which is rich in green leafy vegetables or milk products are a good source of vitamin D and calcium. Of course, a vegetarian will have slight difficulty because a good source will be from animal products. But saying that, there are a good amount of substitutes in terms of soybeans or good green leafy vegetables and fruits which can help you in getting most of these vitamins. So, by keeping yourself active, physically active, and having a good, healthy diet would definitely help you in restoring the bone health so that you don't get this osteoporosis or weakness, which can cause a devastating fractures even with a simple fall. So, let's imagine a situation where the hip is actually broken. So, what do we do then? When the hip joint is broken and cannot be fixed, we do what is called as a replacement. So we take away that broken bit of the bone and we replace it with an implant. So this has got a few things to it. Hip replacement is one of the most successful surgeries across orthopedic specialties. It is one surgery which has revolutionized the life of many patients because you take away the pain, you get them walking the next day, and usually within 4 to 6 weeks, they would have forgotten they had the surgery done. Okay, they can climb stairs, they can drive, they can do everything else apart from a few precautions like squatting on the floor. Is told to be avoid squatting because that might put the joint at risk. Apart from that, every other physical activity is possible. So when we do the hip replacement, there are few words that come across. What kind of metal is it? So usually hips are metal alloys. They are made up of titanium, stainless steel, cobalt chrome, and alloys of the same. So every hip joint has two components. One is a ball, other one is a socket. The ball sits in the socket, and there is a stem. The stem goes inside the femur. So these are the three components of a hip replacement. And this hip replacement, which was invented by Sir John Chanley way back in 1960s, has been evolved, and today what we can say is we have some gold standard implants out there which have a longevity of more than 25 years. So these are, first the stem is inserted into the bone, and then we put this ball, and then that goes inside a socket. So once it is in, it starts behaving like a normal joint with most of the movements. There is something about what is the best implant that can be used, or there's something about cement and uncemented. So basically, when we fix this stem or this cup inside the socket, it has to hold on to the bone. There are two ways of fixing to the bone. One is by adding cement, where the cement goes and holds the implant inside the bone or in the socket, or something called as uncemented, where we put some porous coated material on the implant, which helps to snugly fit with the bone and it integrates with the bone. So these are the two main types of replacements. Other one is called as a hemi replacement or a total hip replacement. Hemi means half a hip replacement, in which we only change the ball. The ball is changed and we put a metal ball, but the socket which was there is untouched. This is usually reserved to people more than 80 years of age who have got low demands. For them, this would do well, because once you have a metal on one side and a normal cartilage or bone on the other, over the next 7 to 10 years, this will erode into the bone. This will erode into the bone. So usually we reserve it for people who have got a lot of multiple comorbidities and who are not, let's say, who are not independent. They're not going out. They've become housebound. Only to those patients we reserve this surgery. Otherwise, majority we get a total hip replacement. There's another word called as a bipolar hip replacement, which is same as a half a hip replacement. So I would like to summarize about the hip joint. So hip joint is one of the most versatile, strongest joints, a ball and socket joint in our body. It helps to make us all these functionalities of gait, jumping, running. All this happens because of our hip can take a lot of stresses. A primary arthritis or wear and tear of the hip joint is rare as compared to a knee joint. The commonest hip problems that we are presently seeing post COVID is avascular necrosis of the hip, where the head of this femur dies. So, depending on the stages, initial stages, we can reverse it by doing something called as a core decompression. But at a later stage, this cannot be reversed as there is a permanent damage to the structure where the shape of the head has gone, where we do a hip replacement. The other thing that is affecting the hip joints in India is osteoporosis, the weakness in the bone, which is making the hip bone, that is the femur, specifically the neck of the femur, being so soft that even a simple slip in the bathroom or tripping over something can have a fall, resulting in fractures to this bone. In which case, depending on their age group, if they are elderly, more than 80 years, we've got a low independence, we do a half a hip replacement or what's called as a hemiarthroplasty, or others who are fit, who have these injuries, will have a total hip replacement. Okay. Thank you very much. I'm more than happy to answer any questions. There's a question for the early symptoms of a dysfunctional hip joint. See, when we talk of a dysfunctional hip joint, now we are talking in the children group. Uh, there is a condition which good that is being highlighted. It's called as development dysplasia of the hip, or called as a DDH. It used to be called as a clicky hips before. So basically, what happens when we as a baby are born in the mother's womb, we all have like this position. You've seen that ultrasonograph, which shows the babies with the hand and legs squashed up. So when this happens, the hip is inside the cup. It's not fully formed yet. In some cases, the hip slips out of the cup. This is called as dysplasia. And when this happens nowadays, it's not common because they do prenatal ultrasound and these get checked. And even after delivery, the pediatrician checks for the hip stability. So in these children, if for any reason they're from a rural background or they didn't have a scan or was it missed, then they develop a dysplasias of the hip. And in these cases, when they start growing, they will be walking, but that leg will be slightly short when compared to the other leg, and they might have a visible limp, and certain positions of the hip will be painful. So these children will complain that sitting on the chair causes ache. They find difficulty to squat on the floor. So these disorders can happen. It's a spectrum called dysplasia of the hip. There's another condition which is closely related called as femoroacetabular impingement. What it means, when this ball and socket is not fully congruent, when it is touching on the edges, then certain movements of the hip causes impingement. They also can have pain, especially while tying the laces or bending down. That can affect. So, what is the best material option for a joint? So, as I was discussing before, there one is the implant company, and what is the type of material use. We have one of the best implants, which are all basically American implants, like Dipure, Johnson and Johnson, and they have got their uncemented hip components. But of course, there is other companies like Stryker, called Trident and Accolade, and now even Miral is come up with their own uncemented hip joints. So this one is a company which have been there for more than 10, 15 years, or US FDA approved. So they have been in the patient's body and have a long time outcome. Second thing is a type of implant. We used to traditionally use a cemented hip replacement, where we used to put cement along with fixation. Nowadays, we have moved to an uncemented hip replacement, where we no longer use cement while fixing the implant to the bone. So we try to get what's called a scratch fit, so that it can integrate straight away. And third thing is a bearing surface. I told about ball and socket. We have something called as a ceramic on poly, which is a ceramic. You all know of ceramic material. It has a very good. It is brittle, but it has got a very good coefficient of friction. So we use ceramic on poly bearing. This has shown in data as the best bearing surface for long-term outcome. Um, More details about the hip replacement. Uh, as I told you, the hip replacement is in India is mainly done either for post-avascular necrosis or following a fracture, for a following a fall. Uh, the components are discussed. You need to sit with your doctor and choose the best option for you. The implant, of course, is very, very important. I mean, there is a lot of metallurgy that goes through this, and we at the moment are using metal alloys. As I said, we use mainly titanium along with stainless steel and cobalt alloys. uh, so these have moved from decades, and now we have reached a very good implant materials which can last for a long time. What is the surgery? I mean, a typical hip replacement takes about 1.5 to 2 hours. There's obviously a pre-anesthetic assessment, where the anesthetist has to give usually an injection to your back called the spinal, which takes about half an hour. Then we need to position you. The surgery is usually an hour long, and following the surgery, again, you're kept in a recovery, where we make sure your parameters like your vitals, blood pressure, everything is fine. And then typically in about 2 to 3 hours after entering the theater, you're shifted back to the ward. So as I was talking to you about the life of the implant, typical hip replacement is meant to last you anywhere between 15 to 20 years. That's a minimum. Some people have seen up to 35, 40 doing well. So, and after this hip replacement, definitely you can do most of the activities like walking, sitting, running. Okay. But what to be avoided is squatting and sitting on the floor or using an Indian toilet. Apart from this, everything else is possible. Uh, So there's another question: how they take care of surgery for elderly patient more than 80 years of age? As I told you, when elderly people break this is because of the weakness in the bones. So we have, because they'll have associated comorbidities like diabetes, hypertension, cardiac, kidney issues. So it's not just the hip fracture; it's the personality of the person himself who has to be taken care of. So it's not just the orthopedic surgeon alone who basically replaces the joint, but there is associated medical fraternity like our anesthetist, the physician, the intensivist, the nephrologist, who all help us in taking care of the patient. How safe is a hip replacement after 60 years? Is one of the most safest surgeries in orthopedics. Of course, any surgery will always have a risk of infection, especially in a person who has got uncontrolled diabetes and all this. And the second risk is of a dislocation, where the joint comes out of socket. Both of these are less than 0.1%. So these complications are almost so rare as 1 in 1,000. Yeah, we are always free to choose our implants like we do for a knee replacement. Usually, as I said, the options are between cemented or uncemented. And second is what kind of a bearing surface. Do you have a metal bearing or a ceramic bearing? All this will have an influence on the cost and also on the longevity of the implant. Yes, you have a freedom to choose your implant. After knowing why you are choosing it, after getting the right information from the doctor, he should be able to guide you for this. In terms of general diet, I mean anything that is good, natural, green leafy vegetables, pulses, or silidania, everything is good source of calcium and vitamin D. Sitting posture, of course, we all know thanks to the software boom and as a service industry, a lot of pressure goes on our lower back. So it is important that you work on your core muscles, the muscles around your waist, so that you can keep your when you see you're always sat up, you're not crouched down all the time, which can affect. So always keep your spine upright. Okay, and 30 minutes of rigorous walking, I think, should take care of the bones. Following hip replacement, basically the cost will be for the physiotherapist. The physiotherapist is someone who's going to come home for the first 15 days, who will help you in making you sit up, get your stability on the walker for the first few days before you develop the confidence to walk independently. So there's a physiotherapy cost. Other than that, there will be dressing changes once in a week, and clips are removed typically within 15 days. So these are the costs that you might incur. Okay, so thank you very much for this opportunity. Hope I have given you some insight